With tens of millions of people in the United States living without health insurance, lower prices for medicine and tests can mean the difference between seeking care and going without it. Even for those with insurance, lower prices can significantly ease out-of-pocket costs. How can we help patients find these lower prices? And might we also use price comparisons in our own practice? You are listening to ReachMD on XM 160, the channel for medical professionals. Welcome to the Business of Medicine. I'm your host, Dr. Larry Kaskel. My guest today is Dr. Leslie Ramirez, a general internist and founder of leslieslist.org, a website that offers comparative pricing for tests and medications at healthcare clinics and medical offices across the Chicagoland area. Dr. Ramirez, welcome to the show.
Thanks for having me, Larry. I'm happy to be here.
Leslie, can you tell me a little bit about Leslie's List, how it started, and just why you even did it?
Well, I designed Leslie's List really as sort of a survival kit for uninsured patients. And I was inspired to do so when my own mother actually joined those unfortunate ranks and became uninsured. So I designed it to give patients some options on their health care.
Mm-hmm. So what happened with your mom?
Oh, I'm happy to say she found some work and she's now insured again.
So when she did lose her insurance, what kind of things did she need to take care of, and what kind of obstacles did you come across?
Well, the idea came to me for the website when she and I were having a conversation over dinner, and she was saying how she had decided to forego her mammogram because she didn't have money to pay for it. And as far as she knew, a mammogram was going to cost her $400 because that's how much it costs at the place that she routinely went to.
And is she in the Chicagoland area?
Actually, she's not. She's in Texas.
So I assume you did a little legwork and made a few phone calls and found out that there was a wide variation in mammogram costs.
That's right. We even found free mammograms, believe it or not.
Did she end up getting her mammogram?
Oh, she did.
Good. So let's move to Chicago. Let's just talk about mammograms. In the Chicagoland area, give me the range of costs that you have found.
We have found a range from, I believe the high is $400. And as I said, we did find a free one, but if you're going to pay for it, it's, I think, $38 is the lowest we found.
And does that include the reading?
Now, the $38 did not include the reading, but the reading usually only adds about 10 to 20% to the cost. And the $400 one did not include the reading either.
Wow, that must have been some fancy machine for $400, or they must have had a large overhead in a ritzy neighborhood. So, doing this and creating the list, have you become optimistic, disillusioned, just confused, or all the above?
About what in particular?
Well, just the fact that there's so much variation in cost and that people are kind of ignorant to the fact that they can shop around.
Well, I wouldn't say that I'm optimistic or disillusioned. I mean, it is what it is. The way our system works here is people involved in healthcare are, some places need to make money and they need to pay their shareholders. And, I'm not here to judge them on that, but I am here to help my patients, and both the ones I see in my clinic and sort of in a more sort of global reach, make good decisions for themselves and find good values so that they can get their medicines and their tests and they won't suffer and they won't die.
Give me an example of how you've used Leslie's List this week. I
use the list on a daily basis, really, and probably the thing I use the most is the medication search. So if I have a patient I always ask my patients, how are you going to pay for your medicine? If they say, I have great insurance, I'll pay a copay, case closed. But if they say, well, I have to pay a portion or something like that, then I immediately just fire up Leslie's List and put in the medicine that I've just prescribed for them and then print off a sheet that explains to them what the prices are at each of the major retailers.
That's a great service. I think I'm going to start doing that tomorrow.
I'll give you a great example. So I had a patient who was on Zolpidem, generic Ambien, and he was complaining he couldn't afford it. And I said, really? You can't afford it? But look, at this one institution, it's $5 for 30 tablets. But he had been going to the other place, the highest cost place on the list, for like $55. And I'd also like to point out that there are definitely some places that tend to be the lower cost but not always. Some of the places that you would think would be really pricey, sometimes they actually have lower costs because of these new special programs that they have.
Yeah, everybody seems to have a new generic program that you can pay a yearly fee for and join their club.
Right, right.
If you've just tuned in, you're listening to The Business of Medicine on ReachMD XM160, the channel for medical professionals. I'm your host, Dr. Larry Kaskel, and I'm talking today with Dr. Leslie Ramirez. She is the founder of leslieslist.org, and we're talking about her website, which offers comparative pricing for tests and medications throughout the Chicagoland area. Do you do brand name or everything, or just generics?
If there's a generic available, that's what we tend to list because our patients are price sensitive, so we assume that they are willing to use the generic. When there's no generic, of course, we list the brand name.
Are there any pharmacies out there that are now matching fees? If you go in and say, hey, I can get this for $6 across the street at Target, will you match that price?
Oh, I'm so glad you asked because that is kind of a little-known fact that many pharmacies will do price matching. Not all of them, but many of them, and they all have caveats about, yes, we'll match the price, but we won't match the $4 special price over at that place. And so you have to ask, but many places will do it, yeah.
And the other day, I personally went and got a Z-Pack for my daughter, and I asked for generic, and I was a member of this club that I paid whatever, $35 a month or a year for. We'll leave the pharmacy name out. And it was still $42. And I was floored. I'm like, what's going on here? $42 for 6 pills that are made in India? So I think I'm going to go to Leslie's List from now on for all my shopping. When they call, do they say this is Dr. Ramirez? Because otherwise they may not want to give out that information.
The pharmacies are actually pretty helpful, even if you don't introduce yourself at all. The pharmacies, I have a lot of respect for how hardworking they are and how helpful they try to be. So, no, we haven't had any trouble at all with their participation.
Let's jump to higher ticket items. Let's say that I'm having excruciating headaches, the worst one of my life, and I decide to go get an MRI of the brain. I go on Leslie's List. What do I find out?
You could get a non-contrast MRI of your brain for $325, including reading fee, or you could go to a different institution and pay $3,400 plus additional reading fees.
And so it's probably the same machine. It's probably a nice GE machine. And the radiologist probably has the same training. And it's just amazing. I mean, that's, what is that, 1,000% increase?
I know. The variability, it's surprising. But again, I try not to make any judgments about it. I mean, people charge what they charge. They have their own reasons.
The same question comes up then. Can I go to that $3,400 place and say, I can go here and get my MRI for $325. Let's make a deal. Because I got to believe these MRI places are hurting the ones that are freestanding on corners.
Right. I'm not sure, actually. I've never asked them if they would do price matching.
I went on the site today for the first time. I did search for a anti-malarial medicine, but I couldn't find it. But I assume not a lot of your patients are looking for that.
Right. The way we compiled the list, we used some data from Pharmacy Association with the 200 most prescribed medications, and then we included the $4 prescriptions, all the medicines that have these great deals. And then, frankly, I put in the ones that I like to prescribe, and I asked some of my colleagues. It was all very unscientific, but we do have a feature on the list where if you don't see your medicine, you can ask us to include it.
All right, so Leslie, can you get me a price on Malarone tonight?
Well, you have to give me a week.
I need it by 2 days from now. I'm leaving town.
Well, here's some news for you. You can do this too.
Oh, I can call the pharmacies.
Yes.
And create my own competing Larry's List. I don't want to mess with Leslie's List. Leslie, do you have any illusions or delusions of grandeur where you want to go nationwide?
Well, I think it's a useful service.
Do you have any sponsors? Anybody sponsoring you?
We don't have sponsors.
I'd be happy to make a donation to Leslie's List.
We've actually had a lot of people say that, but we haven't set up anything to take donations or right now we're listed as an LLC, just because that seemed easier to set up, frankly, than a nonprofit. So that's still in the works for us.
What else do you have in your sights for growing the site, or are you just happy with what you have?
I would love to have the site spread to other major metropolitan areas. Dallas, Texas, where my mother is, would be my next.
You just need another passionate Leslie.
I know.
There's got to be another one out there.
I sure hope so. I would love to, in my dream world, there's some philanthropist out there who wants to take the ball and run with it.
How much time, Leslie, do you spend on this a week?
I spend about 20 hours a week.
Is that making phone calls or just updating and
compiling lists and, making phone calls and researching for the blog articles? Because a lot of patients out there, they contact me and ask me questions that I don't know the answer to, like insurance questions or COBRA coverage or something like that. So they inspire me to write these little informational blurbs on the site. So I spend a fair amount of time doing that as well.
Now, besides drugs and tests, are you looking at what doctors are charging?
Oh, that's a great question. And I have to say, I have not gone down that road.
You don't have a site where I can go get a physical from Dr. Kaskel for $89, or I can go across the street for $120.
Well, I will say this. We do have a low-cost clinic database on the site. So, while you can't really price compare the same way you can with the tests and the medications, if you're someone who's looking for low-cost services, you can certainly search that database by, if you're looking for pediatrics or dentistry or primary care. We did include that. When I said I wanted the site to be like a survival kit for the uninsured, I really was trying to think of all the different aspects of care and design the site to address those.
And what did you learn about your own practice as a result of creating this website?
I would say that it's changed my prescribing habits, absolutely. I take into account if I think a twice-a-day medicine versus a once-a-day medicine, if the once-a-day medicine is 10 times as expensive as the twice-a-day, then I'll have a conversation with the patient. Would it be worth it to you? Is the convenience worth the extra cost for you? Because if you don't know how much things cost, you can't have these conversations.
It would be, I'm just thinking it would be great to have, like Hippocrates, a Leslie's List on your PDA. So I think you should work on that next. I think that would be a nice little application, either for iPhones or for PDAs. Maybe Hippocrates would be interested in talking with you.
They would have to be local.
This is Chicagoland only currently, and does it involve the suburbs, or does it stop at certain borders?
It's Chicagoland, including the surrounding counties. We are really aggressively trying to include testing sites in the western suburbs and parts beyond, because we've gotten a lot of requests for it.
Congratulations with the work you've done so far, and I look forward to seeing the growth of Leslie's List, and I'm going to use it starting tomorrow in my practice.
All right. Thank you so much, Larry. And if there's any other medicines you need prices for, you know how to reach us.
Thank you. My guest was Dr. Leslie Ramirez, founder of leslieslist.org. I'm Dr. Larry Kaskel, and you've been listening to The Business of Medicine on ReachMD XM160, the channel for medical professionals. ReachMD, online, on demand, and on air. Please visit us at reachmd.com, and thanks for listening.